Hey everybody, I'm here in Erin's room where she is not working and we aren't working here either. Just wanted to reach out and touch base with you to let you know what's going on here at our office. We have been closed now, going on 5 weeks here, and we're sheltering in place and staying safe, and we hope you are too. We wanted to just touch base with you and tell you a couple things. We're really looking forward to reopening just as soon as the CDA and the ADA and the CDC and all the other agencies say that it's safe to do that. I know that a lot of you out there have some deferred work that needs to be done. You know, you're wearing a temporary crown or you have a chipped tooth or something like that's going on. Some of you have called me with emergencies like some swelling, and some have even had root canals done at the specialist office. So I'm well aware that there's a lot of work that we are behind in getting to, and we want to get to you just as soon as it's safe. Um, I also wanted to tell you that for your safety, we're going to be making a few changes. We're still forming our own safety guidelines, but here are the few things that we can do to help make things even safer for you. First of all, if someone comes in and they're sick, we're going to need to reschedule you. Unless you have a life-threatening dental infection or you've been in a car accident and knocked your teeth out, we're just not going to be able to see you if you're sick. So if you come in and you're sick, we're going to reschedule you, and I'm sure that you'll all understand that. When you arrive, we're going to be taking your temperature and asking you a series of questions to make sure that everything is safe and that you're healthy and well. So I hope you understand that as well. If you do have a fever or symptoms of illness, again, we'll probably reschedule you. If you bring a companion, and a lot of people do, especially if they're sedation patients, if you bring a companion, we're going to ask you to have the companion wait off-site, either in the car or out in the hallway, because the fewer interactions that we have, the safer it is for everybody. We're going to continue our policy of seeing one patient at a time. It's always been a good idea, and it's an even better idea now. With one patient at a time coming in the office, it just minimizes the number of interactions and allows everyone to stay at a safe physical/social distance. As far as being on time is concerned, we've always tried to run on time here, and we're not always perfect either. But it's going to be even more important to run on time and have everyone be on time. What that means is we don't want you to come early either. We don't want you to come late, but we don't want you to come early because, again, that increases the opportunity for unnecessary interactions and exposures. And then if you show up late, then it's going to be difficult for us to have enough time to do all the extra things that we need to do to make sure that the room is safe and clean for the next patient that follows you. We're going to have to change all of our personal protective equipment and all of that sort of thing, even more so than we have in the past. So please show up on time, not early or late. When you arrive, we're going to be asking you to wash your hands or to use some hand sanitizer that we'll provide for you. We're also going to be asking you to rinse with Peridex mouthwash. Peridex mouthwash is a chlorhexidine-based mouthwash that's very safe. And when you rinse with that, it'll reduce the amount of bacteria and virus that's in your mouth and in your throat. So if you gargle and rinse with that for 30 seconds, it's going to make the experience much safer for everybody, not just us, but the other patients who follow you. In every procedure that's possible, we're going to use either a rubber dam or another isolation method. We use an isolite here. That's not always possible with every procedure that we do, but when it is possible, we're going to do it. Because if we only expose the tooth that needs to be worked on, we can keep it nice and clean, disinfecting it again with chlorhexidine, then we're going to minimize the risk of the procedure for us and for you and for everybody that follows. One other change that we're going to make, typically when you come into the office for cleaning, I like to come in, I like to see you because I really enjoy meeting with all the patients, and I like to do an exam every time you come in. Well, that's making a little bit less sense now. So what we're going to do is, instead of me seeing you at every hygiene visit for an exam, and I'm sure I'll still get to say hello, but instead of actually doing an exam, we're going to schedule exams once per year, and we'll probably do that right before your hygiene appointment. It'll be a more thorough, comprehensive exam rather than the quick exam that I typically do when you come in for a cleaning. By doing that, again, we'll minimize the number of unnecessary patient interactions and reduce the possibility for exposure. And the benefit to you is that doing an exam once a year, it'll be more thorough. We'll have a chance to really see what's going on with you. And I'll get to spend more time with you and catch up with you and what's going on in your life. We've always taken pride in the sterilization protocols that we do here in the office. We get OSHA trained once a year, which is twice as much as is required by law. And I think we do a really good job. But one thing this coronavirus has taught us is that there are a few other things that we can do even better. So we're going to be upgrading things around here to make things even safer. Dentists in general have always been really, really safe and really tuned into the whole cross-contamination situation, much more so than the general public, that's for sure. As you may have read in the New York Times, dentistry is the #1 most risky profession as far as catching this virus. So we're going to be extra careful with you and with our staff and with ourselves so that we can keep everybody nice and safe. We really appreciate you understanding as we navigate this new frontier. I know everybody has been very patient. We're going to need to start seeing patients before this pandemic is over, because I suspect that there are still going to be cases out there a long time after they reopen the country and allow us to start seeing non-emergency patients. So during that period when there are plenty of other cases out there, diagnosed and undiagnosed, we're going to have to be extra, extra careful to keep everyone super safe. We really appreciate you being our patient. Thank you so much for being our patient, and especially for being so patient during this period. I'm acutely aware of many of you out there who have reached out to me with dental problems, and I wish I could be taking care of you sooner rather than later. When we get back to work, we're going to be very busy catching up with all the work that needs to be done, and we'll try to get to you just as soon as we possibly can. So please hang in there for just a little while longer, and we'll take really good care of you when we come back to work. So on behalf of myself and my wife Allison and Elizabeth, my assistant, and Aaron, our hygienist, we wish you all the best. We wish you to stay safe and healthy, and that we all get through this safe and healthy, and then we see you again in the very near future, and we look forward to taking really good care of you. Take care now. Bye-bye.